gonna pick up the pieces.
Each of these women have different stories, different ages, different hobbies, different personalities, but one thing they all share is the maintenance of a strict gluten-free diet in accordance with celiac disease.
My name is Sarah Edmondson. I am 17 years old, and I was diagnosed in October.
My name is Julie. I am 31 years old, and I haven't been formally diagnosed with celiac disease. It does run in my family, and I was tested last year, and the tests were inconclusive, so I'll be going back this year to be retested.
I was diagnosed sophomore year. My name is Marlena.
More than 2 million people in the United States have celiac disease, or about 1 in every 133 people. Among people who have a first-degree relative, a parent, sibling, or child diagnosed with celiac disease, as many as 1 in 22 may have the disease as well.
Celiac disease is a condition that's genetically inherited that reduces your ability to process a particular substitute called gluten, which is found in rice, barley, and wheat. Because of that, you get an immune response to the ingestion of gluten that causes inflammation to occur in the gastric mucosa. Over time, if you continue to do this, you can experience all kinds of symptoms and increase your risk for getting lymphomas of the GI tract.
If a person with celiac disease continues to eat gluten, even after diagnosis, studies have shown that he or she will increase chances of developing gastrointestinal cancer by 40 to 100 times.
The biggest risk of ingesting gluten are the increased risk of potentially developing a lymphoma or a type of cancer as a result of that. Additionally, failure to thrive or the inability to process needed nutrients leads to weight loss, a general feeling of malaise, and overall an inability to function as a result of not being able to process needed nutrients.
This is why it is so important to maintain a gluten-free diet in which patients may not consume the following items:
Semolina, chips, pasta,
Cookies,
Pizza,
oatmeal,
Skittles, and Snickers bars,
muffins,
pastries,
cereals,
brownies,
anything with gravy in it,
a regular flour tortilla,
bread,
bagels,
cake.
basically anything that's good. In addition to gluten-free, I'm lactose intolerant, so I cannot eat anything that contains dairy, so milk, basically, no cheese. I can't eat pizza and ice cream.
The most common symptoms of celiac disease are gastric discomfort, so abdominal pain, diarrhea is a big one, weight loss, runs the gamut of flatulence all the way down to certain skin conditions like dermatitis or pediformis.
Symptoms may vary.
When I eat gluten, it usually just bloats my stomach and I get really bad stomach ache or really bad pressure in my stomach, and so I really can't sleep well.
The most severe symptom that I have is stomach pain. I get very bloated when I have things like cookies. Pizza is a big no-no. Even beer. Can't drink beer.
The most common symptoms I face are having problems sleeping, falling asleep and staying asleep, and a loss of appetite. So if I eat a bunch of gluten in the morning, the chances of me not eating the rest of the day are pretty high. And sometimes I do get bloated when I eat gluten.
Awareness of the condition of celiac disease goes a long way to how people can help people with the condition. So early recognition of the symptoms, as well as being able to provide alternatives for food substitutes. So instead of barley and wheat, a lot of rice-derived products can be substituted for it. There are organizations now that give the ability to provide gluten-free substitutes.
It really hasn't affected the people around me because they eat whatever they want, but it's harder for me because I see them eating everything I want to eat, like pizza, I see them eat like a hamburger, I see them eat bread, a sandwich, and I can't eat that, so it really is hard for me to keep on my diet while they get to eat whatever they want.
It affects my everyday life greatly. I can't go out to eat certain places, so if my friends want to go to a certain place to have dinner, I'll either have to tell them no or suck it up and not eat at all because the items on the menu all contain gluten. I have to be very picky about what I eat in the office. If lunch is brought in, sometimes I can't eat what they offer, and I see other people eating delicious cookies, and it's hard for me to resist because they look so good. So yeah, selecting gluten-free items off the menus is really difficult sometimes, and you have to be really careful because, you know, gluten can be hiding in things like soy sauce and things you would never think.
Okay, I literally have to watch everything I eat. If I ever want to buy something and I'm kind of unsure about it, I have to pick it up and I have to read all the ingredients that are in it to see if I can eat it. And my family and friends have been really helpful. I know whenever I want to go out and eat with my friends, they're always looking up places that have gluten-free menus. My family's always making sure that I can eat wherever we go.
The primary treatment for celiac disease is avoidance of anything that contains gluten. Like I said before, there are more and more stores that offer alternatives to gluten products that taste just as good as the original. Additionally, use of systemic steroids to decrease the inflammation in the gut have been used, along with certain other steroid-sparing agents like dapsone have been used to mediate some of the symptoms associated with celiac disease. But the most important is definitely avoidance of any gluten type foods.
Dr. Alessio Fasano, a pediatric gastroenterology specialist at the University of Maryland Hospital for Children, director of the University of Maryland Center for Celiac Research, and professor of pediatrics medicine and physiology at University of Maryland School for Medicine, has been conducting stem cell research of intestinal cells in celiac patients to be used as an intervention to repair the damage to the villi. Because the intestinal lining is damaged in celiac patients, it is the best source for harvesting stem cells because of the constant need for change during the inflammatory responses.
To help fund this research study and other studies in the field of gastroenterology, simply link your preferred savings card to your community partners card during your next shopping trip to Albertsons. Simply present your preferred savings card for scanning during checkout. That's it, you'll start helping the Celiac Disease Foundation earn contributions on all eligible purchases. Despite the tremendous obstacles these ladies face every day, from strict diets to stomach pain, they still manage to lead a normal life, engaging in cooking, schoolwork, and even running. We can only hope to make similar bounds in research as these young ladies continue to live life gluten-free.
Baby, can you help me? I think I lost my way. I'm in need of shelter, far above this place. And I can see a castle high up on this hill. Could it be my
Donate to the Celiac Disease Foundation at celiac.org.